Hello, my name is Daniel Stillwell. I am the editor of the IFTA e-newsletter, and we have with us today Sigrid and Louise. So thank you both for being here. We also have interpreter Mikey. So I wanted to give an open floor to talk about who you are as clinicians and the work that you are doing and the presentations that you are giving here. So welcome.
Great. Thanks, Dan.
So Louise and I do work together as a collaborative team.
Mm-hmm.
I am a deaf person. I'm a culturally deaf person, so I do the cultural part of the access that we provide to our clients, and so I sort of do the background stuff when it comes to culture. And Louise?
I'm a psychologist, and I've been a psychologist for many years. My previous work was as a nurse, so I've got a couple of hats that contribute to my work now. And it's just been nearly 2 years that Sigrid and I have been working together in this allyship model, where Sigrid brings her lived experience as a deaf woman, and I bring my experience as a hearing person, working with a lot of deaf clients, clinically, in community work, in art programs, in lots of different areas. And I've spent a lot of time trying to educate professionals around how to work in culturally affirmative ways.
Right.
And there's always been a bit of discomfort around the fact that I'm hearing and doing that. So having this allyship model and the benefit of the wisdom that Sigrid brings has really just changed the way we're working, the way I'm working, what we're able to offer.
Fantastic.
Yeah.
Before we get to your specific work, and I'm really excited about the topic that you are presenting on, can you tell me a little bit about what the work looks like in Australia as a whole, just because we have people from all over the world?
Yeah.
Well, again, a bit of context for everyone looking. I work a lot with my own community, which is the deaf community, and looking about advocacy in different spaces, especially in mental health, arts, culture, any sense of community life, really. So that's part of what I do. And we've observed as a community that there are major gaps. And when it comes to the services and professionals actually having an awareness about what the deaf community needs are. And if we want to refer them on to people, there is only a small amount, like a handful of organisations and people that understand deaf culture and deaf affirmative ways. So we want to make sure that, if we're going to get supports or interventions, that they are effective. So we need to make sure that services understand the needs of the community. So I was familiar with Louise's work, and we sort of knew each other as individuals. And I know Louise had similar observations and noticed and highlighted a lot of the gaps, and that's how we've worked in collaboration now, and here we are. And just trying to really ascertain how we can offer something to the community out there, and just then create wider supports for the community that we're here for.
Wonderful. So your presentation, tell us a little bit about the focus, the topic, and then we'll discuss it in further detail.
So we chose a very small gap, because there are lots and lots and lots of gaps in what's being provided for deaf people in Australia. And the presentation focused on the connection between language deprivation syndrome and theory of mind deficits. What we have in Australia, there's a lot of deaf adults who are struggling because of language deprivation, and the research has really focused on the prevention of that for children, but there's almost nothing on how to work with adults who are living with the consequences of not having access to a fully rich language that is really important for cognitive development. So that was the presentation, and we've combined some of the very little bits of research that are out there to come up with a program that might actually offer some opportunities for deaf adults to develop some of the skills that the language deprivation has really impacted on.
I think when people, especially from different cultures and different languages themselves, the terms language deprivation and theory of mind. Can you give some definitions of those so people know what we're working with?
If we look at language deprivation syndrome, more so, look, there are multiple factors and multiple symptoms that we have to sort of be aware of. And the impacts basically stem from the fact there is no language from a younger year, either a spoken language or a sign language. So they're not having any language at all, and then that obviously has a flow-on effect and consequences when it comes to adulthood. And in our community, we're now sort of starting to recognise and coin the phrase language deprivation syndrome, and that's allowed Louise to sort of know a little bit more about the research and what's going on out there. So together we've worked on this and trying to offer some solutions, just give them something for deaf people who have gone through this. Because if you remember, deaf children are going to become deaf adults.
Right.
Naturally. So the research is relevant to children, that's great, but then there is still that flow-on effect and lifelong consequences of this language deprivation syndrome.
And theory of mind, what does that mean for you?
So theory of mind is a concept that doesn't have one specific definition, but it is the capacity to imagine another person's feelings, thoughts, to imagine outcomes based on, we talk about consequences. If this happens, then that's the prediction. It impacts your capacity to have autobiographical memories in timelines. It impacts your capacity for empathy, for being able to hold multiple perspectives. So these things have, if you struggle with those concepts, you struggle then to have good, healthy relationships.
Right.
And I think one of the key things that people don't realise is that 95% of deaf children are born to hearing parents. So you're immediately in a family that doesn't have sign language as a natural access language. And so the risk for then family breakdown, communication breakdown, and then a lack of role modelling for how to have healthy relationships, it's just a snowball effect.
I have also heard that the sense of belonging is often at risk.
Yeah, absolutely.
Right. Okay.
Yeah. Deaf people often don't come to that sense of belonging until they leave the family or leave school. So then later adolescence, they're kind of acquiring more sign language and developing an identity within the deaf community. But a lot's happened. We know developmentally that if that sense of belongingness and language doesn't happen until 15, 16, 17, there are consequences. And I think I said earlier, we chose this one small area to focus on because one of the things that I hear a lot from professionals is they say, well, I had an interpreter in the room, so I thought we bridged all of the possible gaps.
Right.
And so professionals don't know about some of these impacts that they need to take into account when they're working with a deaf person. Because if they don't, you're looking at misdiagnosis. What we also call missed, MISSED diagnosis. And then you've got problems with treatment, with intervention, with support. And so having an interpreter is important, but it doesn't cover all the bases. There's a lot of background information that professionals need to have.
Right, and not every client has full safety with every interpreter. So what can be shared, how vulnerable they can be, that's not always available. And I know especially when you're working with dysfunctional families, that safety net needs to be created, and adding a new person, especially if they're not someone they're already familiar with, can jeopardize the clinical effectiveness.
I love that you've mentioned that, and I'm going to throw to Sigrid in a minute, but that really points to the power imbalance between the deaf and hearing world. And, one deaf person comes into a room with a bunch of hearing therapists, or the hospital's full of hearing people.
Right.
I think the power dynamic is important to actually name.
Yeah, you've covered it. A lot of the people I have these conversations with and what we do with our work and talking with professionals, they'll often say they didn't really understand the importance of a deaf perspective. It's really opened their eyes to a lot of things that they were just sort of blind to, and things that they had never really considered and had the opportunity to consider. So that's why we're here now, and you know, talking about power imbalances and how we can manage that and how to rectify those issues, and getting that deaf lens in, that deaf perspective in, someone who's had that lived experience to unpack these sorts of concepts. And that's why it's important we work together as a team in this allyship, to have a deaf person with that professional in there, and then having the interpreter and the client all working together as a team, because you understand all the different perspectives, and then that just leads to better outcomes for the individuals.
And it feeds the trust and safety that you mentioned.
Let me ask a clinically practical question. So bringing awareness to this is the first step. But we only have a few minutes to share your work and story with the people. What would you want the audience to take away from your work so far that they can bring to their communities, whatever they look like?
That's a very good question, isn't it, Louise? You start or finish? What do we choose?
Yeah.
Yes.
But we have actually developed education modules for people to do online that are the basics that any professional needs, and that's teachers, clinicians, parents who have a deaf child and are thinking, I don't really know what deaf culture is, what does that mean?
Oh, yeah.
And then we kind of build up to some clinical modules around diagnosis and assessment as well. So that's a recent project that we've done to try and fill that gap. So in the Australian context, there's nothing that people can do that's video on demand, and we have very, very few deaf clinicians. I mean, I could count them on my hand in Australia. So, yeah, so we've tried to fill that gap by providing bilingual, bicultural. Sigrid and I present together English, Auslan, and we've tried to make it relevant to international contexts in English-speaking countries.
Right.
Can't cover everything.
Of course.
Yeah, I think the most important thing to acknowledge is for professionals to understand that they don't know everything. And I guess that's the first step, just to be open-minded enough to say, yes, there is more out there that I need to learn, and then just to investigate and seek the knowledge out. And I guess just looking for a direct voice from the deaf community that's relevant to a professional's work. But yes, like Louise said, the training modules there are trying to give that sort of foundation and the different perspectives that are out there at the moment. And we share other perspectives from other deaf people as well in our training and in our practice.
Oh, good.
And we help people to understand what they need to be looking for, what information they can then go away and research and see what is out there, and then that self-reflection on their own practice.
Wonderful.
I think probably
Go for it.
one more thing. There's layers of identity when you're moving into this work. So we've got the disability identity and the deaf identity, the hard of hearing identity, the developmental identity. And I think maybe that's missed, and maybe that's why people think, oh, I've got the sign language interpreter, we're covered.
Yes, I do a lot of work with people on intersectionality, and the fact that you're bringing up the idea that deaf culture is not a monolith.
Yes.
That you have these layers built in, even that might be an eye-opening experience for somebody watching this right now.
Yeah, great.
Okay, so I want to pick your brains, and we can talk after this about nuances, but we have to wrap up. Let's wrap up with something a little more fun and personal. So share something with the audience about you personally or professionally that you think would be interesting for them to know.
Oh,
that was sprung on us, Dan.
Sorry.
No, we love something that's a challenge, that's exciting. Well, outside of work, my love at the moment is my 2 Italian greyhounds.
Okay.
And we're a long way from them at the moment, and they're at home, and I'm getting updates from the house sitter.
Of course.
So, yeah.
Lovely.
Yeah.
I think for me, look, I haven't mentioned the fact that historically, and I think how I got into this, just look at it like I started out as an environmental scientist.
Oh.
So my philosophy And I think really does link in well, looking at that environment and the ecosystems that we are living in, and then that links into community as a sense of community.
Yeah.
So I see similarities there. I know it's a bit of an unusual way, a bit of an introduction to how this all happened, but that's just my brain.
Yeah.
Some of the original family systems theorists started in the environmental sciences. The cybernetics was all connected, so the mental jump is not far. So wonderful.
Yeah, exactly right. Like, so outside of work, as much as I call it work, I'm a gardener. I love working in my garden.
So, lovely. Thank you so much for being here, Louise and Sigrid, and Mikey. Thanks for your help. We really enjoy the idea. I mean, IFTA is all about exposure and engagement, and that I think you are bringing it to us very nicely. So I really appreciate it.
Thank you so much. It was a real pleasure.
Yeah, and we really appreciate you too, Dan, in inviting us to be interviewed.
All right.
Thank you.